All right, we're going to finish talking about the endocrine system by talking about some of the common disorders of the endocrine system. Our essential question are, what are the common disorders of the endocrine system? The first one we're going to concentrate on is the disease called Addison's disease. Addison's disease is actually a malfunctioning of the adrenal gland, primarily the adrenal cortex. Remember, the adrenal cortex is the outer portion of the adrenal gland. There's two layers of the adrenal gland. There's the adrenal cortex and the adrenal medulla. Symptoms of Addison's disease, typically you have the bronzing or this tanning color of the skin even when you haven't been out in the sun or haven't been exposed to the sun. Typically you have a low sugar or a low glucose level, lower than 60. Orthostatic blood pressure, what that means is that your blood pressure will vary depending on whether you're laying down, standing up, or sitting down. Blood pressures will be different. A lot of these patients experience nausea and vomiting, weight loss, and of course any type of imbalance in electrolytes. Typically, we treat it with replacement hormones. And the reason that I have a picture here of John F. Kennedy is because he actually did suffer from Addison's disease. And I guess that's always why he kind of looked so handsome on TV with that bronzing skin and all that kind of stuff. So Addison's disease, adrenal cortex. The next one we're going to talk about that has to do with the adrenal gland, or a disorder that has to do with the adrenal gland, is called Cushing syndrome. The cause of Cushing syndrome, here's some pictures to help you understand it. Typically, these patients will look very different. They'll start out looking fairly normal, and then they'll develop into this really round moon face, gaining a little bit of weight with it as well. So the cause is that typically it's either a tumor that's located on the adrenal gland, or it's an overuse of steroids. People take steroids for many reasons. Steroids are used to speed up medications, to speed up the immune system, to help you fight off stuff. So typically, the overuse of steroids will cause this type of disorder. Symptoms that these patients have, which are shown in these pictures, is of course you have that moon face. Of course, they'll have the hypertension. They'll typically have this big round belly, obesity. They'll have lots of bruising. Typically, it's very hard for them to heal. Usually, they get excessive hair in places that they shouldn't have it. They also typically will have high sugars, and they'll have this buffalo hump, which is this hump on the back part of the neck. How we treat it is typically, if it is a tumor, we're going to remove it. And of course, if it's caused by an overuse of steroids, then usually they were going to, of course, take the patient off steroids to help get rid of that disorder of Cushing syndrome. Sometimes it doesn't always go away. We're next going to talk about steroid abuse in sports. Typically, people will use steroids. Males will typically use it to kind of increase their muscle mass, to make them stronger. But what happens typically if you overuse steroids is that it'll affect your liver, because your liver detoxifies, remember. It'll also decrease their sperm production because, of course, it messes with their gonads, or their testes. And of course, it'll also decrease the size of their testicles, which in turn does relate to the decrease in sperm production. They'll also get breast enlargement. A lot of times they'll develop acne. And of course, they're always putting themselves at an increased risk of any cardiovascular disease. Now, females who use steroids, typically what happens to them is they will lose their menstrual cycle. They will no longer menstruate. They'll start to get abnormal body hair. They'll start to develop kind of like a man. They'll start to have more male-like features. They'll become bald, or they can have voice changes. Here's an example. Here's a female. She used to look like this, and then after a use of steroids, this is what she ended up looking like. These big, large muscles, of course, and you can see definitely affected body hair and her physical appearance. All right, so next let's move on to pancreas disorders. Remember, pancreas has a lot to do with insulin and the regulation of sugar in the blood. So what's a normal blood sugar? That if you were to check somebody's blood and use the machine to actually test their blood, what would be normal? 60 to 120 is a normal blood sugar range typically. What is the most common symptoms of patients who have diabetes? First of all, they're going to have polyuria, which we learned about in the urinary system, means excessive urination. They'll have polyphagia. What that typically means is they'll be very, very hungry. Polydyspia, which usually means excessive thirst. They'll want to drink all the time. They typically will lose weight. They'll have blurred vision, and then they'll possibly, if it gets really bad and undetected, they'll go into a diabetic coma. Here's just kind of a cartoon that shows you. Here's always tired, weight loss, wounds that won't heal, which is not one that we mentioned over here in the symptoms, frequent going to the bathroom, they're always hungry, always thirsty, blurry vision, numbness or tingling in the hands and feet, which has a lot to do with the neuropathy, and then of course vaginal infections in females. And all right, next we're going to move on to understanding diabetes a little bit further. There are two types of diabetes. There is diabetes type 1 and diabetes type 2. So let's first focus on diabetes type 1. Diabetes type 1 is actually one that is treated, or that is most common and going to be in your juvenile or pediatric population. It's usually the one that we call juvenile diabetes. The cause of it is that usually the pancreas does not have enough insulin or secrete enough insulin in order to regulate the blood sugar in the blood. So typically, how it's treated is that unfortunately they have to check their sugar every day, 3 or 4 times a day. They also have to do daily insulin injections, sometimes 3 or 4 times a day. They have to really watch their exercise, and they really have to control their diet as to how many carbs and sugars that they typically eat in a day. Like we talked about, the age group that's most commonly affected by diabetes type 1, which is usually your juvenile diabetes, is definitely going to be your children and young adults. Now they have all these new inventions that are out, like insulin pumps that are supposed to help regulate blood sugar and give insulin when needed, to kind of help take away the sticking of the finger and the actual needles and injecting all that kind of stuff. It's supposed to help. Some patients do very well with it and others do not. The other type of diabetes is diabetes type 2. This is the one that we've had such an increase in our country due to the diet that we consume now in our Western culture. This is usually caused by an insulin resistance, okay? So it's not that the body doesn't make enough insulin. What has happened is that the body is resistant to the insulin that the pancreas is making. Diabetes type 2 is treated by diet typically. They'll look at weight reduction and really trying to decrease the amount of weight or overweight that a patient has. They'll also too look at glucose monitoring, and more than likely they'll put on an oral pill, like some kind of medication to help control their diabetes. Complications that can occur from diabetes is definitely heart disease, like we talked about. The vessels in the body do not like high sugar blood counts. They like, normal blood sugar counts. Hypertension is another one, and then of course poor circulation can also be a complication, simply because the nerve endings are also going to be affected by that increase in blood sugar in the blood. Like we talked about, why does this happen? Why do we get these complications from diabetes? Typically because we talked about it when we talked about the kidneys, how the kidneys do not like their vessels to be exposed to either high blood pressure or high pressure on the arteries, and they also don't like to be exposed to high amounts of sugar in the blood. So those are the reason. Also too, increase in fat on the vessel walls can also block vessels and narrow them, leading to heart attack or strokes. Here's a pictorial to kind of show you the difference between diabetes type 1 and type 2, and to show you the normal. Here's a normal patient. They have a bloodstream, they have red blood cells, and they have these little glucose molecules. Okay, well, these glucose molecules are going to be very attracted to your insulin receptors or your insulin hormones that are secreted by the pancreas, and so of course it's going to really help to decrease the amount of glucose in the blood. But with diabetes type 2, what happens is that the pancreas does not produce enough of these insulin receptors, not enough of these insulin hormones, so therefore it cannot keep up with the amount of glucose that's in the blood to decrease it, to keep it at a safe range of 60 to 120. With diabetes type 2, what happens here is that these insulin receptors, instead of them being nice and receptive to these glucose molecules, what happens is they reject them. They say, hey, we can't work with them. It's just too much sugar. It's just too much for us. And so then again, you have an increase in blood sugar in the blood as well. So both of them have increased blood sugar levels. The cause is definitely different. One just has resistance and the other one just doesn't make enough. All right, the next one we're going to talk about is the pituitary gland. Remember, the pituitary gland is located in the brain. There's an anterior and posterior. We're going to talk about acromegaly versus gigantism. If you remember back to functions and structures of the endocrine system, we talked about the pituitary gland. And remember, the anterior pituitary gland secretes growth hormone. Well, acromegaly and gigantism have to do with the growth hormone. So we're going to first focus on gigantism. Gigantism is where you have overproduction or a hyper-functioning pituitary gland. So what happens is, guess what? You're going to secrete way too much of this growth hormone. And when that happens, you have these really, 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 really tall people. They grow really, really large, usually occurs during adolescence. They have an overgrowth typically of their long bones, and remember, the long bones are like the humerus. The femur, the ulna, the radius, the tibia, and the fibia are all going to be very excessively long, which leads to very tall patients. Typically, how this is treated is we usually give them a drug, some kind of injection, to inhibit the secretion of growth hormone. The sad part is about gigantism and all of these pituitary gland disorders, acromegaly and gigantism, let's go back, is that typically these patients do not live very long. They typically die at a fairly young age. And when I say young, I mean like 50s. Like they just don't typically live long just because their body has so much surface area and their poor little heart works so hard to provide blood flow to all of those organs in that large body. The other one is acromegaly. Acromegaly is actually where you have a hyperfunctioning pituitary gland again, but this is going to occur more in your adult years. So remember, in gigantism, this occurred during adolescence. In acromegaly, this typically occurs later on in life. So typically in the adult years, what's going to happen is they're going to get an overproduction of cartilage. And they're going to get the cartilage primarily in places like their nose, their ears, their chin, their hands, and their feet. They're going to get this overproduction. You can see it in this lady. Here is a before picture of her, and here's an after picture of her, and you can definitely see the difference. That increase in growth hormone late in her adult years has caused her facial features to change. It doesn't show you her hands, but if it did, or it showed you her feet, you would definitely see an enlargement there as well. Again, treated typically by drug therapy to inhibit that growth hormone. Okay, we are going to stop here and start the video on the next one. The next video we will start with the pituitary gland disorder of dwarfism.